And I went to UBC to do my family medicine residency. And now I'm back in Calgary working as a family doctor.
I'm a psychiatrist in Calgary. I went to the University of Alberta for my undergrad in sciences. So I did 4 years of psychiatric residency training and practice as a psychiatrist at the Foothills Medical Center.
I'm originally from Zimbabwe, or Rhodesia in those days, and I did my undergraduate medicine there. And I went and actually did a residency in radiology for another 5 years. I'm currently a diagnostic radiologist at the University of Calgary and in the Calgary Health Region.
I'm actually still completing my undergraduate degree. I'm in my 4th year of neuroscience at the University of Calgary.
So I'm in clinic Tuesdays and Thursdays. It's usually between 9:30 to 4:30 plus some paperwork hours. And I see somewhere between 24 to 28 patients. And then my senior home day is relatively flexible. I go to 3 different Chinese-speaking senior homes in the city.
Usually I'll go to class in the morning. I'll have 1 or 2 option classes, and then I'll go to a neuroscience seminar. And then on Fridays, I'll go to a seminar hosted by a researcher at the Hotchkiss Brain Institute at the University of Calgary.
So there's lots of specialists in different specialty techniques, and there's lots of imaging techniques you can use to diagnose most things. But if you can put it broadly, it will be like trauma, pain, oncology, which is cancer imaging, and then other types of imaging for different specialties as well.
I didn't know that being a family physician is such a wide range of things that we can do in terms of just really designing the schedule the way I want to and really pursue my interests. So it's not like a Monday to Friday all day clinic type of job.
I think the perseverance, I think, is a really important quality. I think you have to be relatable, then to be inquisitive and always sort of wondering if there's something else which is going on, or if there's something that's been missed, or if there's more to the story.
So if I make a diagnosis, they don't agree with it, I want to find out the reason why and what is their train of thought. Usually that's tied to their life experiences as well. And just to address the elephant in the room, and if there are difficult emotions that's in that encounter, usually I just state it and empathize with them and just see where they're at.
Because diagnostic imaging or radiology has really advanced in the last 10 or 15 years. We can provide a lot of services, and the problem is the lack of equipment to actually provide a timely service for the appropriate test to the appropriate patient at the appropriate time. And it's almost like a shortage of the imaging services available, and that can be frustrating. So that's part of the job I don't like, is the fact that the lack of resources available.
Earlier in your degree, for an undergraduate degree, I would say a lot of test-based assessments, a lot of shorter assignments, tutorials you attend, and you have a lot more smaller elements accumulating that constitute your grade. And then the further you get into your degree, you have more courses where there's a lot of conversation, a lot of writing about your opinions in the topic. So just in terms of undergrad, it would be like labs, lots of mixed assessments. And then later in your degree, it's a lot more about presentations, just writing papers.
What I found is traveling in a lot of countries and having worked in a lot of places is that there's many ways to solve a problem, and there's no one set way. And you're going to go across to do medicine in, say, from North America to Europe or other places. You have to remember that when you come back, you'll be considered an international medical graduate, and there may be processes involved in actually getting into residency programs or job situations, such as doing local Canadian exams or the American exams or something to get into the system again.
I don't have any radiology tests that I can actually use. I don't have any blood tests that I can use. The diagnostic instrument is me and the person in front of me. And so it's very much asking questions, but also reading to the questions. It's one of these things that over years that I can get much better at reading people and seeing where, and being able to zero in diagnostically as to what the issue is.
To be optimistic, I don't think my job will be replaced anytime soon. There's a huge humanistic part to medicine. I mean, I don't understand the AI field all that much, but I feel like that humanistic aspect, it cannot be replaced by AI.
And the point of AI is to actually make the job of radiologist easier. A simple thing is like if you're sitting in an emergency seat at midnight and you've got a pile of X-rays on your list, there are programs now which the AI goes through the list of X-rays and recognizes that there's urgent problems and brings them to the top of the list. So if you're sitting with 100 X-rays, instead of going them down in order, it'll bring up the things which you look at first, and that helps triage. This is a form of triage to look at the urgent cases, more important cases.
It's a very tight-knit community because it's a pretty small class every year. So that's so great. You get a lot of support from your peers. There's a lot of really good hands-on experience that you can get from it. Like you'll learn a lot of lab techniques, lots of different model organisms through both class, and there's also like out-of-class opportunities like research doing in the summer, like I talked about. But there's also lots of resources for people who are interested in medicine or industry. They're really good at connecting people with the path you want to take through neuroscience.
The field, technology advances at a fantastic rate. If you don't attend conferences, if you don't attend lectures, if you don't read articles online, you don't go to clinical conferences, all that, you're going to fall behind, and you've got to keep ahead.
Teaching and research also keeps me active. So I always find when I'm teaching, when you have a medical student or you have a resident who's asking you, why do you do things in that sort of way, or what about this, it forces you to sort of be thinking about, oh yeah. And they often bring in extra knowledge.
The most important thing, I think, even though people don't realize radiology, at the end of the day, when you're in medicine, you're dealing with a person. So when you're seeing a CT or an X-ray or something, at the end of the day, it's someone at the end of the line who's asking you for help. And if you keep that in mind, with whatever character you have or whatever personality traits you have, you focus on the job. It doesn't matter whatever personality you have, as long as you focus on your job.
And from my perspective, like my involvement in biomedical research, it's a bit different because if you are interacting with patients, it is very important, of course, to be personable and empathetic, but there are routes in research where if that's not who you are, that's okay. And you can still be involved in health sciences and medicine without directly interacting with people. So kind of the way that it's been presented to me is there's 3 main routes out of neuroscience, where there's industry, medicine, or research. But you can work in industry where you work with the development of different technologies, working with just like in a more commercial setting, and you can be an advisor for a company or working with like a startup company, for example. And then there's also, you could go to med school, pursue lots of different medical degrees. And then research, you can pursue a master's or a PhD and get involved in research projects. And those are kind of the main ones that I've learned about throughout my degree.
I mean, you think about the role of the different sort of info technology and biotechnology is likely going to be the future, and that's going to influence much of what's all going to happen in the health sciences and medical fields. I mean, Holly's probably already found out that coding has become so important to actually, being able to run all your sort of data analyses that wasn't the case before. And so increasing your knowledge of how to code and work with different databases is going to be increasingly important.
So I think one of the important things in life is when you go, especially if you're a grade 12 student, you choose an undergraduate degree, try and keep it broad. Like you may go into a degree and you do it and try and keep it broad, so keep your options open. The other thing is, don't get set back by, if you find you end up doing a degree and you don't like it, you can always change. After the first or second, you can transfer to another course. And even if you finish doing the degree and spend another 4 years, life is long. It's the longest thing you do. And there's no harm in actually changing track or something to something you like. The other important thing is to keep true to your principles in knowing that what you want. Don't let others influence you because they like something or something. They're trying to get you to do something. You get advice, get opinions, but at the end of the day, you have to decide which direction you're going. Obviously, you can get help from a lot of peers, or you can get friends and advisors, but you have to stay true to yourself.